Hello, everybody. I'm really delighted tonight to be here with dear Eric Robbins, who is a board certified urologist from the Los Angeles area in the United States of America and an energist, which is a wonderful and unusual combination, but very much the best of both worlds. Thank you so much for being here with us tonight, Eric.
Thanks for having me, Sylvia.
Okay. Yeah, tell us, please, a little bit about what you do.
I've been a urologist in practice for 26 years, and for the past 15 years, I've kind of had a niche where I see complex pelvic pain referrals from all over Southern California. I'm in a big medical group, and our group takes care of, I think, 5 or 6 million people. And
Wow.
yeah, really, I mean, I kind of ended up over the years just having this niche where I see the most challenging cases. And it's interesting because there's when people have chronic pelvic pain, obviously there's a standard medical algorithm that we go through, and I do that as well. But a lot of people that come to see me have already seen really good physicians, and they've exhausted all the standard medical paradigms. So at
Yeah.
that point, I found it helpful to kind of incorporate other mind body healing modalities to kind of help them along.
I've heard you actually wrote a book or co-authored a book on energy healing all the way back in the day.
Yeah, in 2002, I co-authored a book called "Your Hands Can Heal You," and it was about chronic healing. And interestingly, I had chronic fatigue syndrome for probably about 35 years, starting at age 15. And my mom had it, my younger sister had it too. And so I was always, for a long time, trying to figure out what is energy and how do we have more of it. And I remember going to a bioenergetic psychologist like in 1997, and the guy said, "Eric, you're getting by on 3%." And I mean, now looking back, I realized, yeah, it was just all my energy was stuck. It was locked up in my body. I was getting by in fumes, literally. Um, I'd come home from work every day. First of all, I just collapse on the floor of my office, usually at the end of the day. And so that really led me, to pursue how can I help myself, and what causes energy and what frees it up and what gives us more of it. And it's kind of been a passion for a few decades now.
I'm sort of guessing there's a star event at the bottom of that. Please forgive me because obviously Star Matrix is very much on my mind. And do you remember the actual moment of Amazing Grace with the energy for you?
The star moment that brought me out of the chronic fatigue, or what,
What
or
what
what?
really made you think, wow, this energy stuff is real?
Well, just having gone through 4 years of med school and 6 years of residency, it was very clear to me that allopathic medicine didn't have the answers. And so I was, like I said, just out of probably desperation, I was interested in finding out what did have the answers. And I can't say that it was definitely a star one event. It was just a series of looking at stuff and trying to incorporate teachings from a bunch of different teachers. And I always say we stand on the shoulders of the prior masters, and that's so true. So these days, I incorporate just a lot of different energetic modalities from so many different schools.
Yeah, cool. So I'm fascinated with the there's this strange thing. You are at the end of a referral chain
Hmm.
where people have been gone through all the standard methods and all the standard treatments.
Yeah,
And that was very much the case for me as an animal behavior consultant as well back in the day.
yeah,
Is that I got to get the really weird cases where everybody had run out of behavioral psychology, out of food allergies or whatever else there could have been to explain this mysterious thing. And I think in a way that's a real blessing. I hadn't kind of realized that until you started to say that. I used to complain about it when I was a young 20-year-old person, that I always used to get the really tough cases. But actually, you're quite right. It is a much more direct path to see there's more to it than the standard problems. Not
yeah,
always, but sometimes there is this other thing that the existing paradigm wasn't explaining. And
yeah,
I was interested in that other thing as well, this mysterious strand that was actually. when you see a lot of these cases, you start making connections.
Absolutely. Yeah.
You can sense there's a similarity. There is something, this is not completely random or chaotic. There really is something going on there. So, yeah, tell us a little bit how you didn't, what you do, how you work with this, what
Yeah, sure.
happens when you get a client.
Yeah. So after all these years, what I'm kind of able to distill out with so many, with chronic pain and with so many folks with chronic medical problems, chronic fatigue, um, is that um, early life stressors and traumas kind of program how our physiology is going to run. In fact, you're probably familiar with the ACE study, the Adverse Childhood Experiences Study. Probably most of our listeners are. And when that was presented, like in the mid 90s, the guy presented this data and he said adverse childhood experiences, early life stressors and traumas cause a lot of disease and early death and heart disease and lung disease and liver disease and chronic pain and neurologic disease years and decades later. And that's been proven to be true, of course. And I think there's been several thousand papers written about the ACE study. But if you reverse engineer that, you say, well, if it's true, and it is, how do these early events cause this disease and problems later on? So you reverse engineer it, you realize early stressors and traumas program how our physiology is going to run literally for the rest of our lives. It sensitizes the fear center of the brain. I think folks kind of the simple way I explain it is that folks kind of get put in this fight, flight, freeze, stress physiology, and that can almost stay on autopilot and for years or decades. And so, even though we say the body tends to heal itself, it doesn't heal very well when it's locked in a fight, flight, freeze, stress physiology. The other thing that happens is, as when especially when we're young and there's events that happen that at the time feel stressful or terrifying or overwhelming, and we talk about the fight or flight response, but a lot of times something's happening to a little kid, they're not going to fight, they're not going to be able to flee and get away, and they'll freeze. And freeze to me means a couple things. Some of it means that we get shifted into this kind of this dorsal vagal parasympathetic immobility response. But I think an equally big, and that bigger part of it, is because we can't handle what's going on at the time, certain parts of our musculature lock down and freeze up. And Wilhelm Reich used to call it Reichian armoring, to hold those overwhelming feelings and emotions in our body so they're not coming up to conscious awareness and bothering us. And I think connecting this with energy, I think by far the biggest thing that blocks the meridians and chakras and energy pathways in the body is these patterns of myofascial constriction that were caused by early stressors and traumas.
And it's interesting. What comes to my mind is oftentimes when you're doing tapping, people have these physical responses, like they might be yawning, or they may be belching, or even passing wind, and they get really worried about that because there's this real physical relaxation when we're doing that clearing of the energy channels.
Yeah.
That's just what came to my mind.
Yeah.
So when somebody comes to you with, say, what would be the symptoms of a typical client that you see?
I mean, I see a lot of pelvic pain. It could either be things like interstitial cystitis, which is where people have to, the symptoms of that are urinary frequency and urgency and bladder pain with filling and sometimes pain with intercourse, or male pelvic pain. It used to be called chronic prostatitis. Or, God, I see the whole gamut. Our psychiatrists for the past few years send me the chronic fatigues and fibromyalgias and the hospitalists. It's interesting. There's a subset of patients. There was some old statistic that said like a very small percentage of patients use up a huge percentage of the resources in any, hospital or medical group. And of course, we found that to be true. So sometimes these real frequent flyers, and I mean, there's people that are in the hospital almost more than they're out, and they all get these exhaustive workups, and usually they can't necessarily find anything that we're able to help. So all these kind of folks get sent, weird neurologic stuff. Yeah. And so kind of in my way of thinking, my presupposition is that these folks are running in a chronic stress physiology, and we've got to find a way of shifting them out of that. And as you probably well know, there's nothing in standard allopathic medicine that does that. They're not medications. And so it's just looking for ways to shift folks out of a chronic stress physiology, unwind these myofascial tension and bracing patterns in the body, and put them in a state where they're more likely to heal.
And well, the topic of this year's conference is New Worlds, and what that means is an expansion. What happens is that when we have a successful intervention with energy, that an expansion occurs, and all of a sudden things are possible in that expanded world that weren't possible before.
Yeah.
So, like, for example, this expansion that you're seeking, that there is a possibility that this person could heal, or there's a possibility that they get out of that loop that they're trapped in,
Right.
into a new world where they could possibly escape from that. So that's really, really
Absolutely.
interesting. And so what happens in real terms? Do they come into your office, or do you go and see them in the hospital bed? What happens?
I've done all the above. I remember there was this lady. I'll just tell you a quick story. She had been in the hospital more than out for the better part of a year, and had literally had the $1 million workup. She had it. She had diabetes. She had gastroparesis, where the stomach doesn't function. It doesn't empty the food. She'd vomit up food that was a few days old, and just intractable pain. They were about to send her to another hospital to have like this $250,000 gastric pacemaker put in. But the only thing they'd guarantee us, they told us, we can't guarantee it's going to work at all, but pay us the money. So kind of as a last resort, they called me. And I remember going up to the 4th floor of the hospital, and the elevator doors opened, and I could just hear these haunting moans coming all the way down the hall. I mean, she was at the far end of the hall.
Wow.
And I went into the room, and it was kind of a 30-year-old gal, and she was in the fetal position in her bed, and she was bruxing, where people are grinding their teeth. I hate that sound. And again, this was kind of early on, but I knew there had to be some events, some early traumas that had kind of triggered all this. And it turned out that her mom had gotten killed, and she wasn't able to be there for the mom, and she had tremendous guilt over some event from the past. And we actually just did tapping and cleared all the emotional charge off the event. And it was like a 2-session miracle. And again, you just clear the emotional junk that's keeping us stuck, whether you want to say it blocks the energy, whether it keeps the physiology stuck in a chronic stress state, whatever it does, it worked. And I had years of follow-up from that.
Cool.
Yeah.
And it's very interesting. I mean, you used the word miracle there, right?
Yeah.
And of course, in medicine, you're not really allowed to use that word at all or ever. But I've just recently defined a miracle as something that happens to an individual person that they never thought would ever happen.
Yeah, it was so far out of their realm of what they thought was possible.
Yeah, their worldview is that, and they live in that.
Mm-hmm.
And then there's more to life than that. And that's what I define as a miracle. For this lady, this was a miracle, undoubtedly. I mean, that she could actually not be in pain for a change.
Yeah, absolutely. She was, in fact, at a couple years follow-up, she was just out of pain, and her gastric function returned. And obviously there's a ton of people out there with diabetes. A very small percentage have this gastroparesis. In my experience, almost all of them, there's a bunch of emotional junk kind of stuck there that's impeding the stomach. It's not just the diabetes.
Well, the diabetes itself could be a result of the the misery.
Yeah.
There's undoubtedly, I would pretty much say that very, very, very unhappy creatures, not just people, not just humans. You get animals get diabetes too.
Mm.
And very unhappy, stressed creatures can get diabetes. But let's not I'm always very careful, because I'm an energist, and that's what I do. And I focus on that, and I leave the medicine to the people who know what they're doing and what they're talking about. And I absolutely also believe we need both. You need physical medicine as well as metaphysical medicine.
Yeah.
But I love that story. Just tell us a few more stories of what you've learned or clients that you've seen. I think that would be really interesting to all of us.
Yeah. Well, one story I want to share, Sylvia, actually ties in so much with what you're doing with Star Matrix, and I studied with a this famous hypnotist a number of years ago named Steve Parkhill, and
Okay.
he supposedly saw the really bad medical problems. Supposedly had some people he had cured of cancer. I never met any of those folks. I can't say one way or the other, but he had this famous expression, and he said, no matter how much manure you shovel out of the shed, people are not going to maintain their healing unless they change how they think and feel. And we all were so trauma based for so many years, and treat the trauma and tap tap and treat the trauma. And you were actually one of the first people that I heard that said, we have to spend some time focusing on what we want, on the positives, and even in with chronic pain. So with I had this patient a few years ago, and they were widely considered to be one of the most challenging chronic pain folks we'd had at our facility. It's a big facility, and they had complex regional pain syndrome. So that's a condition, extreme nerve hypersensitivity. Literally, like
Mhm.
if you drop a paperclip on her shoulder from 2 inches away, she'd like be in bed for 2 days. Severe pain. So to give you an idea on a scale of 1 to 10, our pain scale, she was like a 20 out of 10, just horrible pain. So we did everything we could within standard medicine. She saw specialists at some outside academic med centers, and they kept wanting her to go see this integrative pain management person, and she kept refusing. And she kept saying over and over, I'm not going to go to see them because they're going to tell me, quote, the problem's all in your head, right? So she didn't want to go see the pain person.
Yeah.
Fortunately or unfortunately, after 7 years of doing the best that allopathic medicine had to offer, her pain maybe was down to a 15 out of 10. I mean, it's so crazy.
Yeah, that's
So,
just still not good.
yeah. So, I mean, she had no life. So finally, out of desperation, she agreed to see this chronic pain specialist. And she's telling the chronic pain specialist how bad it is and how bad her shoulder pain is. And the specialist said, well, I'm wondering if you could do something. I'm wondering if you could um, notice a part of your body that feels different, that feels the opposite of that. And she goes, no, 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 no. You don't understand. My pain is so severe, I could never for 1 second stop focusing on it. And the pain specialist said, listen, let me tell you a story. She goes, have you seen the vinyl record? They play in the record player. Naturally, she had. She said, if I took a deep, like a scissors and made a deep scratch in the vinyl, is the record still going to play? And the answer, of course, is no, because the needle or the needle is going to hit that scratch and go into that deep groove.
Mhm.
So the pain therapist said, listen, I'm not judging you. I'm not minimizing your experience. She goes, naturally, everyone in the world, when they have pain, we're all focusing on it. Everyone does that. She said, but at a certain point, when the pain starts becoming chronic, every time after that, we're thinking about it and upset about it and anxious about it, we're making deeper scratches in the record. Now, these scratches in the record that we're talking about is more like central pain pathways in the brain and spinal cord. So she said, at a certain point, the more we're focused on the pain and the more we're focused on the pain, you're making deeper and deeper scratches in the record. At a certain point, it's almost impossible to stop thinking about it. So she goes, I get what you're going through, but the way to start healing is to start noticing what feels different and better. Okay. Now, to this
Interesting.
patient's credit, for a half a second, she switched her attention to the opposite shoulder, which just kind of felt neutral, and then she went back to the pain. But to her credit, she shifted her awareness and attention to the other shoulder, which felt okay, and then went back to the pain. And it wasn't one time or two times with this, or 10 or 20 times, or one or two sessions, but over time, she began to direct her attention to a place that wasn't the pain, that felt neutral or good or safe. And she started developing new neurologic pathways for feeling different and better. That's called pendulation. Peter Levine talks about it. You talk about it in your own way, which I love, the Star Matrix way. And her pain, that got her pain from a 15 to a 7. And it really started to give her life back. And then we did some other things to also help kind of downregulate her physiology. That's a perfect example. You cannot get healed just focusing on the junk, the crap, the trauma. There's a role for that to be sure, but you have to focus on some positive, how you want to feel. Yeah, so important.
It's very, very interesting, isn't it?
It is.
It's yeah, it's I was particularly struck by the lady who didn't want to go and see the pain specialist because she was afraid she was going to be told it was all in her head.
Yeah.
Now, one of the things that we know, thank God, at long last, is that emotions aren't in the head. they're in the body. We feel
Yes,
them in our body.
absolutely.
And when emotions become painful, we call them psychosomatic pain,
Yeah.
but it's still only an emotion, and an emotion is only energy at the end of the day. Tell me a story with emo. I would love to hear an emo story where emo has really helped or where it was
Oh,
useful.
gee. I'll tell you an interesting story that I think ties into this pendulation too. Again, these are great, just kind of teaching stories. So, I had some lady I was working with one time, and we're talking about some issues going on in her life, and she started having some contraction in her throat and her chest, and she immediately goes, "Oh, that's my ex-husband." Which, which you've heard this a million times, right? So everybody in the world laughs at this story, but everyone does the same thing. They have an uncomfortable sensation, a gripping or something in their body, and in a millionth of a second, their mind makes it a story, a label, a thing, adds meaning to it. And I said, "Listen, I'm sure your ex-husband's way too big to put his whole body, right in this part of you. That's not him. It's not the bad ways he treated you, and it's not the mean things he said to your kids. And could we allow those sensations just to be there as raw physical sensations? And when you get people to do that, when they can actually get out of their head and just notice things as sensation, which you would call energy, um, then things soften, and oftentimes it can begin to flow. In her case, we got some good movement of that energy. And I mean, as you know, when you have a successful emotrance session, um, sometimes people have really big cognitive shifts and they just think differently about so many things in their life. And that story stands out.
Well, I believe that the word energy is interchangeable with information. So
Mhm.
that when that literally is like energy starts to flow, is that this information flows. And that's when people are going, oh, and that, and oh my God, and I just remembered that. And it really is as though there is an information flow there, a literal information flow, not metaphorical.
Yeah, right.
That's happening. And I think this is part of this moment of expansion where the world becomes bigger, and all of a sudden there's then more possibilities for the person inside. Oh, tell us some more. Tell us some more stories about the miracles of energy healing in the
Yeah.
context of how I described it.
Yeah, sure. I feel like, I've had a couple marriages that were saved. Same thing. The people came in, said, "We're done." And, that's also, you say, well, if you separate these people and say, when you think about your spouse, where do you feel it inside? And they usually feel a gripping or a clenching inside. It's a feeling they don't like. And again, if you can just get that to soften and flow and get energy to move, I mean, and to the point where there's nothing to dislike when they see their spouse, then they usually end up staying in the marriage. So, yeah, emo's been enormously fun to play with. Um, I would say I think that not everybody that I do emo with does the energy flow that easily, and I think sometimes it's useful to maybe do some myofascial release stuff to just get these really locked up areas in the
Yeah.
fascia to to release, and then sometimes the energy stuff becomes even easier. So, yeah, I found that in myself particularly, um, yeah, do some sort of myofascial release. I use something called block therapy, which is it just really gets in and unclogs things, and then the energy stuff even moves faster.
So how do you actually do that? Is
So
it
in
massage?
no, so in block therapy, there's actually a wooden block. It's maybe a little smaller than a yoga block, and the corners and edges are smooth. And you'll lay on the block, and the first thing is she'll have you put it in areas that you would normally do it. Like I'll lay on it under my side, on your sternum. So many of us, by the way, just hold so much in the chest and sternum and the neck and the sternocleidomastoid and really all over the body. And when you do it, if the fascia is locked up, I mean, it's not that comfortable, but you stay there and you breathe, and these areas start to release, and it's enormously freeing. I mean, it allows the lymph to flow better, but just from my standpoint, it makes a lot of these I was one of these folks that, like I said, I was getting by on 3%. I was so locked up that a lot of these things that I had success with patients really weren't working on me. Tapping, I worked with hundreds or thousands of people with tapping, worked great for most of them. It wasn't working for me. Because I mean, literally, when the energy is so locked up and you're so frozen, I think sometimes we need something to free that up. So the block is the best thing I found personally to just help release these areas of bound myofascia. Um, Interestingly, I had heard my son Jonah had heard about it initially, and he was excited about it. And I really didn't want to try one more thing, and he brought the block over to our house one night. I remember, and he said, just lay in the block for a little bit. So I think I put it under my mid quadricep and laid there for 3 minutes. And again, it's kind of uncomfortable, and put it under my calf, and not thinking much of it, really having no expectations at all. And an hour later, I felt this surge of energy like that I hadn't felt in a long time, and just this deep feeling of well-being and this groundedness. And I know everyone, their brother, talks about groundedness and this and that. This was really a deep body level sense of groundedness.
A
Actually,
proper
talked to.
experience,
I'm sorry.
a proper experience, a personal experience.
It was a personal experience. It was funny because I was talking to a bioenergetics friend of mine. He studied bioenergetic psychology, and he says that the earlier the traumas, the lower down in the body, and the legs and feet are the myofascial contractions, and so it keeps the energy from going up. So actually in the system of block therapy, she'll have you start fairly early on releasing stuff in the calves and the upper legs and a lot around the feet and ankles, and it really does it opens up the energy, and it really does give you a body level sense of groundedness. And I'm okay now. I'm safe right now in my body. And again, that's been a really good adjunct for me and for some of my patients actually too.
Cool. Well, in an ideal world, these things are like energy and physical or allopathic medicine aren't separate.
Yeah.
Because the body isn't separate. It's not the energy body that wanders into somebody's office, and the physical body without a soul goes into somebody else's. So, those things should really be together in when we are thinking, when we are acting, when we are prescribing, when we're diagnosing.
Yeah.
They should really be, at the end of the day, they should be together. I kept on thinking about a wooden block's a nice thing, but how wonderful that would be if this was a living person who was massaging the feet or the ankles and actually really responding to what they're feeling as in the energy, but also in the flesh and bone. And
Yeah.
if there was that additional thing of that this person is really loving and wanting that client to get better, you know, I
Yeah.
mean, much as I love a wooden block as much as the next person. And I can see the attraction of it because it's not going to be judgmental. You don't have to, I don't know, pretend to be somebody like you are normally with human beings, and
Hmm.
it's a block, so you can just let go. It's fascinating, isn't it? Life is so much more interesting with energy, I find.
It
Um,
is.
I was going to ask you, you were on special duty during the pandemic now for very, very busy and hard at work. What were you doing?
Yeah, so they took volunteers to work on the COVID ward. I think that's what you're talking about. And I was on a COVID ward for 5 days. And the one of the most stressful things for me is I hadn't fully been vaccinated, and so I was wearing an N95 mask all day, and I was constantly testing it. You do the blow test, to make sure it's airtight because I'm in these rooms with these COVID guys, and yeah, it was very fulfilling. Mainly, my intention with it was to help out our hospitalist because these guys were really working hard for just months and months on end.
Yeah. So did you, what sort of, what can you tell us about it? What did you learn from this? That would be
You know,
interesting for us to know.
well, no, no, no. I learned a lot. The probably the biggest thing I learned is that when folks get sick enough with COVID that you have to hospitalize them, there's not a tremendous amount that we can do from allopathic medicine. I mean, obviously, you give them supplemental oxygen, we give them steroids to kind of calm down the immune response. We give them some antivirals, but and the other thing is a lot of these people came in, they had comorbidities. One guy was at home, had oxygen-dependent emphysema. One gal was getting chemotherapy, one guy was on dialysis. So they were all kind of fairly sick to begin with. But I just remember thinking, these people are laying in their beds and we're doing the best we could for them. And I just kept thinking, if
Yeah.
there, I wish there was a way to kind of infuse them with energy, to kind of help promote their body to heal itself better. There may be opportunities to do that to folks in the hospital, which would be nice if folks kind of had a regular practice at home to kind of do that. And who knows if that would have kept them out of the hospital to begin with. But yeah, just they needed to heal. And yeah, that was kind of the most challenging thing.
It's not, yeah, it is also giving the mind something to do while they're lying there suffering.
Yeah.
I mean, for me, guided meditations and hypnosis totally is the thing when I'm poorly or
Hmm.
in pain or in discomfort and I'm just getting really stressed and unhappy in myself. I stick on the headphones with a nice hypnotic meditation and I zone out and give my body a chance to relax and do its virus fighting thing, whatever it's doing. And I might, stepstone like that through a whole night. When it ends, I'll pick another one. And when that ends, I'll pick another one, and so on and so on. And I always thought, really, this is so healing, something like that. And
Yeah.
again, we have this thing, we're not just an energy body, we're not just a physical body, we are a mind as well.
Hmm.
And that mind needs to be in the game, in the healing game, don't you think?
I agree. And I also think that just folks being hospitalized and going through medical procedures themselves is so traumatizing. I mean, there was some data, a number of years ago. I mean, as you know, childhood medical procedures, can cause PTSD in little kids. And again, they'll carry that with them
Yep.
for years or decades. It's really important just to kind of watch our languaging when we're in the hospital, and always give hope. You're right. That's so so important.
Yeah.
It's
I
easy
I
to be
I,
down with
I
that.
did I actually had a course a long time ago called Hypnosis for Healers.
Mm,
So that you'd give, like at least positive suggestions while you're doing this and not saying weird things.
yeah.
Like I remember one lady said to her client after a really successful session, person was pain-free and happy. She actually said, "Oh, I hope it doesn't all go away the minute you step over my doorstep."
No, don't say that.
Oh, and guess what happened?
I can't imagine.
Oh, yeah, sort of more integrative. It's
Yeah,
also kinder and humaner, isn't it, when we actually address people's emotions and how
yeah,
they're feeling and their minds as well and their questions. Ooh,
absolutely. There's also no doubt, as you know, that I mean, when we walk in and see a patient, we've got the white coat on, and we're that authority figure. I mean, their unconscious is wide open. Everything we
yep,
say goes right in, and it's
yep,
so important just to, you don't want to give false hope, but there you can say so many things that will encourage folks. And again, calm down their physiology. Yeah, that I agree. That's so we I mean, every doctor is a hypnotist, right, in that regard, and almost no one's been trained in doing it, or even giving like waking suggestion. Yeah, I agree with you. So important.
that's really interesting, and that's something that I would have hoped there is a great resistance, it seems, in the medical field in straying outside its own boundaries that it set itself.
Yeah, I mean, yeah, I mean, I'm as surprised with it as anybody, or I mean, I remember there was this old Winston Churchill line, and he said, "Men will stumble over the truth from time to time, but most pick themselves up and walk away as if nothing happened." And I just say that in regards to, I mean, to the stuff I do at the hospital, and other physicians see it, and they'll refer patients to me, and I don't know. I mean, I thought if I had witnessed, some of the, I mean, I've been able to help a lot of people in really challenging cases. I would think the referring physician would like camp outside my door and say, "I'm not leaving until you teach me. What are you doing that is so different?" And it's not that I'm that brilliant. I just am willing to kind of do this work. I had to start doing it to heal myself. And yeah, I people see this stuff and they just seem to, I don't know, not want to learn it or think it's too difficult. Or similarly, sometimes doctors will get sick and they want to do the standard allopathic regimen, that's fine, but at least incorporate something that may help your body heal a little better, and that's just not even in the consciousness yet, that there's a way to do it, that you can do it. Um, yeah,
Very
yeah,
interesting that, isn't it?
yeah.
It really, really is quite interesting. But also really encouraging that they allow you to do your thing.
Yeah, it is. In fact, I actually won at our organization. There's about 10,000 physicians that work there, and every year 12 of us win this PEC award, the Physician Exceptional Contribution Award. And a couple years ago, I won that, which was
Right.
the biggest honor of my life. But even maybe even more importantly, um, I kind of they did it based on all this alternative integrative stuff that I'm doing with patients. So that was a big recognition.
Ooh,
Yeah.
that's very interesting,
Yeah,
isn't it?
yeah, and it is interesting because they actually got up to have us speak, and I was speaking in this huge ballroom and just talking about a lot of the stuff we've done, the ACE study and early traumas affect healing. And I got to say, I looked down. I remember almost everyone in the room was literally sitting on the edge of their chair, like leaning forward. I mean, I distinctly remember that. That's one of my happy memories or star memories or whatever you'd call it, a star matrix. But yeah, it was fascinating. But again, after that night, it's not like a bunch of them, said, teach us this stuff. And so I don't know. But you know what? We're getting there. And the way I look at it, it's like you have this huge locomotive that's stopped, and it takes a heck of a lot of energy just to get it to
Yeah.
go that first quarter inch and half an inch and 1 foot. But then you'll build up the inertia. And so I think all the stuff we're doing is getting there. It's going to be a process, and you just got to keep the faith, and we all just got to do the best work we can. And I do think the consciousness is gradually expanding so that more folks are kind of opening to this.
Yeah, and it's not I mean, I have made it my life's work to make it so that people can understand it,
Yeah,
that they don't have to believe in it, that they can, hang a modern energy chart on the wall and
right.
actually see the stages in their kids, in their partners,
Yeah,
to have a beginning of a scientific instrument for emotions, if you want to call
yeah,
it that.
right.
The science of love, the new science of love. I wrote an article about that the other day, and I
Did
just said
you?
we need the science of love. We need to investigate this. I have presented a couple of starting instruments that we can use to start an investigation. We can start asking questions. We can collect data. We don't have to believe in what somebody wrote in an old scroll,
Yeah,
and we can actually go from lived experience, which is all the rage at the moment. It's a
right.
great word to use, lived experience.
Yeah,
Sometimes
right. I
it's a
agree.
weapon against real science, but I don't see why lived experience can't be a part of a real scientific process.
Right.
That's
Yeah.
fair enough. So, now, what do you see happening sort of in the future with this? Do you think that the work you are doing and will open up, how will that translate into more of the same in the future, or more better care for the patients in the future?
Yeah. Well, I think some of the science is showing. Um, I think some of the science is actually coming back and showing us the benefit of like doing somatic psychology and doing energy work. I mean, like for example, Dr. Porges' polyvagal model. I realize that's just considered a theory and a model, but in my experience, that's extremely accurate to what I'm seeing in a clinic with the vast majority of folks. So
Yeah.
it is kind of a model, but it's a very workable model for what I'm seeing. And I'll tell you, when these sick patients come in, I pretty much in my head know where they are in that polyvagal curve at all times, and I know where we're at and the direction we need to go in to have them heal. So some stuff like that I think is important. I'm always touched by that. If you remember Eugene Gendlin at the University of Chicago back in the 80s, I don't remember that study, but Gendlin realized that a lot of people do therapy and the majority don't necessarily make many gains at all. And they also realized that a very small percentage of people in therapy really have tremendous life changing things happen. And so, they looked at hundreds or thousands of hours of therapy sessions, and he found that he was able to narrow down in the first session who's going to benefit from therapy or not. And of course, who the folks that benefit from therapy, when the therapist asks them a question, instead of going up in their head and intellectualizing, they'd go into their body and they'd say, oh, when I think about this, it's just kind of this weird, nebulous. What they were doing was going in and noticing a felt sense. You could call it
Right.
stuck energy. You could notice what's going on in their physiology. But folks that are willing to go in and notice sensation and deal with that, whether it's emotrance or tapping or myofascial release or pendulating or a whole variety of these somatic tools, that's what gets people better. And so I think, people are gradually coming to, where the rubber hits the road. I think people are starting to look at what works and gets results, and hopefully that'll drive things, economically. And it's a process too. These old institutions it's hard to get over institutional thinking, but it's happening.
Hmm. I was just thinking about a study that's just been, they're actually still doing this at Oxford University
Hmm.
into the experience of pain. And they have discovered that dum, dum, people who are emotionally unhappy experience the pain more severely than people who are neutral.
Yeah, absolutely. Yeah, we see that all the time.
They didn't do the experiment with happy people. That top half of the scale is missing again.
Right. Oh, you
They
mean
just
they just looked either at kind of neutral or folks with,
negative,
got it,
negative or neutral.
got it.
Negative state of emotional upset, resting state of feeling nothing.
Hmm.
And they didn't put that third data point in.
Yeah.
And that's near as damn it a triangulation, isn't it? If you haven't got that third data point there of what happens if you've got a happy person, you
Yeah.
know, you, you
Physiologically regulated. Absolutely.
you're just
Yeah.
not going to get to the real meat.
Yeah. It's interesting because we see that all the time too. The classic thing, a guy comes in with testicle pain and, he's obviously worried about it, thinking about it, worried it's a tumor, thinking about it in such a way that's making him anxious. When we're anxious, our body's going into a fight, flight, freeze, stress physiology. And I tell the patients, there's a few things that happen when we're in a stress physiology. The stress hormones sensitize nerve fibers and pain fibers. So stuff
Mhm.
literally does hurt worse.
Mhm.
The stress hormones increase inflammation of the body. They increase where the myofascial constriction. So the pain literally does get worse. Now they see somebody like me who can examine them and tell them, listen, it's nothing serious. The only thing that changes when they walk out of the office is they start to think about it differently, and they think about it in a way that calms and down regulates the nervous system, and then the pain frequently just gets better. So many of these guys, I don't have to do anything at all except just reassure them, but there's a reason why that works. It's not just luck.
No, it's because you're raising the energy essentially as well. And this is why I'm thinking that the just giving people a modern energy chart and saying that you start getting stressed, do something
Yeah.
and set up a bunch of ways in which they can raise energy fast,
Yeah.
um, so that they can give them more of a, I don't know, a handle on their own chronic pain.
Yeah. Yeah, I
Because
mean, again, yeah,
just raising energy is going to reduce the experience of the
I
chronic pain.
I agree. I mean, we tell these folks, and it doesn't necessarily. I mean, obviously, it's good if they can get into the +10 but even just notice the pain and then notice a part of your body that just feels the opposite. Now, Sylvia,
Yeah,
one of the challenges, though, as we see like folks with fibromyalgia come in, and I'll say, everything hurts, and I'll say, find a
everything
part of your
hurts.
body that feels the opposite, and it may only be the little toe on their right foot, but you have to start somewhere. And again, it's training the mind to go back and forth. It's the movement. I tell them we're not trying to get rid of the pain to make it positive. It's just shifting awareness and attention and starting to develop new neurologic pathways for changing. So, right,
Mm.
doing something else or taking a breath or doing something to break that cycle is so important.
as you see quite a lot of clients, I'd love you to do sort of a sneaky experiment for me and let me know in a year from now. Um, if this is correct, is my assumption is that chronic pain decreases when energy levels rise. What makes our energy levels rise above all else is when we think about someone we love.
Mm.
That was my thing that I had that night when I thought I was going to die, and the voice said,
Mm.
find something to love. And I had this experience of this big water wheel starting to spin in the opposite direction forward.
Mm. Oh,
Because
wow. That's such a powerful
love is an
metaphor, too.
outward going. Love is an outward going thing. You know, when you love, it flows out of you. And what that does, it creates a vacuum at the back that sucks more energy so that you can, pour it out. And that flow raises energy fast. So be interesting if you have the odd client there, and just do that as an experiment. If they've got somebody they love, a grandchild or a dog or partner or a movie star even, and what their experience of pain is when they really think about that person for a little while, perhaps comment on why they're so amazing.
Mm-hmm. Mm-hmm.
When we love somebody, it flows from the lips, doesn't it? Oh, he's so lovely and he's so kind and so caring and so wonderful and so good looking. And we're both smiling. It's
Yeah.
a powerful way to raise energy. And do you know what? I'm going to say it. I don't care. If somebody really loves Jesus, wow, that's also something that I believe that's just not activated enough
Mm.
in mind body healing. If somebody really really loves Jesus, that is a powerful thing. That's a resource.
Yeah.
That's an energy that can raise us up and make us be less afraid and less
I
in
agree.
pain.
I agree. Yeah, I mean, I might be using slightly different terminology and talking about neural pathways, but yeah, it's breaking the habitual cycle. Yeah, I agree. That's so important. It goes back to that Steve Parkhill line. They have to start thinking differently and looking
Yeah.
at life differently. And that guy had his share of really tough cases. Yeah,
Mm. And
that's kind of a refrain I'd say too. It's not just shoveling the manure. It's not just getting rid of the trauma. It's learning
no,
to think differently and feel more
no.
empowered and get your body moving into it and all that stuff.
And see, the reason that I work with the power of the positives and the
Hmm.
love thing and all of that, find someone to love, is because when you are stressed and depressed, generating positivity or thinking differently is very difficult.
Hmm.
However, something like finding something to love has a natural gravity that helps you.
Yeah.
There's a natural gravity, if you're thinking of a grandchild, for example, that kind of pulls the love out of you. So you don't have to do it all yourself, all by your lonesome self. When you're
Right.
already exhausted and
Right.
struggling with physical pain for so long, there's a natural gravity to it that helps you. And this is why I'm so, keen on working with positive memories. There's that same natural gravity that helps you.
Yeah.
And you don't have to do everything yourself, which is kind of one of the sad things of Western culture, isn't it?
Right. And I mean, I think putting in the time to be, because it's not easy for most of us. It's definitely it was not easy for me to have a gratitude list or remember positive memories. And I mean, it takes work and it takes perseverance.
Yep.
And it's one of the best ways I think that people can spend their times. I couldn't agree with you more. But again, for folks that are chronically sick, it's not, it's a process. And I always tell the patients we're setting a direction, and maybe 2 steps forward, 1 step back, but
Ooh,
fine.
no, we're
Go
not
ahead
going to say that anymore.
with that.
We're not going to say that anymore. We're not going to say 2 step forward, 1 step back. We're going to say 2 steps forward, 3 steps forward. It's a process.
Yeah,
Two
it is
steps
a
forward,
process.
3 steps forward. Sometimes it's fast and it's 8 steps forward. Sometimes you
Yeah,
only get 2 steps, but it's a process.
it is. But it's a really worthwhile way to spend your time. And I
Yeah.
mean, again, I agree with you that is a really good way to shift physiology. And people always talk about what should I do between office visits. Bernie Siegel had that book written years ago by the same title. And there's a few things that really have a lot of bang for the buck. And that's one, either focusing on the positive memories, making it easier and easier to develop neurologic pathways for feeling good, happy, uplifted, getting the energy flowing, maybe incorporating the body in some of that too. Yeah,
Yeah, there's a lot our mind and our systems can do to activate healing, I think, even and at the very least, let the poor physical body get on with it and do its healing thing without getting in the way. I
yeah,
mean, that's where I mostly come from. So yeah, okay. Well, that was fascinating. It was really, really interesting. And it's a shame that we haven't got a, I don't know, $3 trillion research grant
right.
to really go forward and investigate how we can help people in chronic pain feel better.
Yeah.
If such a grant was given tomorrow, miracles can happen, can't they? What would you start with? Where would you start?
I would start just by educating medical folks, that again, and as you just said, we're talking about chronic pain, not acute pain, and not
Just
cancer
chronic
pain.
pain.
Yeah, chronic pain. I'd let people know that the two basic things that are going on with it. There's a lot of nerve hypersensitivity. There's a lot of muscle tension and contraction, and that at a higher level of truth, at a higher logical level, you'd have to look at why those are happening, because those don't happen in a vacuum either. Those are frequently due to early life stressors, traumas that's set that physiology of how it's going to run, and then working at those higher levels of truth to hopefully, downregulate the physiology and shift folks out of a chronic stress state. And yeah, that's what I would do. Just look at it from that higher level, that vantage point,
Yeah,
because that seems to work for a lot of folks.
set up a training program in, basics of emotions.
Yeah,
And, if you don't understand emotions, you don't understand people.
yeah,
This
right.
is really it. One of the nice things is that you can use the word emotion interchangeably to energy. If you don't want to say the word energy in order to spook the horses, we mustn't know anything about energy. you know, you can use the word emotion. You can say that, well, people have these pains where there are stuck emotions that haven't been processed
Yeah.
properly. And then we haven't said energy.
That's like that scene from Young Frankenstein. That's so cute. Yeah, yeah, no, I mean, certainly in the medical field, I mean, yeah, we'd stick probably with the word emotions and traumas and physiology and
Thank you.
yeah,
Yeah, yeah. For now, that's fair enough, and it's good because the fact is that people are human beings as well as doctors, and they can see what's happening in front of their eyes.
right.
You know, we're back to your Churchill quote there. What they need is a safe and logical and reasonable framework to put their lived experience with their patients in. And this is really what I've tried to create with Modern Energies, to make a reasonable framework where actual lived human experience fits into this framework and explains it without getting all, ooh, lizards from outer space. To keep it nice and simple and straightforward. Human beings have emotions. Where do they come from? How can
Yeah,
we test that? It's what happens when we are in better states, emotional states. What happens with our healing?
yeah,
What happens with our intelligence? See, this is, yeah, that's where I would spend my research grant. Loads of people doing that. Okay, all right. So I'm so sorry. We've come to the end of our chat. And I want to thank you so much for sharing your insights and experiences with us, because this is really, really great. And it's wonderful to know that you are out there and that you are helping people in a way that other doctors can't.
yeah. And hopefully it won't die with me. I mean, hopefully we're going to get a bunch on board, And I mean, that's kind of the goal, right? I mean, you've spent so many years building a world-renowned organization, and yeah, you're kind of actually motivating and inspiring me right now to get this knowledge out there. I mean, it's stuff I
Yeah,
take for granted, and it's
yeah,
kind of simple, actually. I mean, you can simplify the science, and it works, and you don't need to. I think so many doctors worry about opening. They ask anything about the emotions, you're going to open Pandora's box, and there's a way to do it. Like I said, just deal with energy and motion and contraction of the body, and just start
yeah.
shifting things at that level. Yeah,
And at the end of the day, science is about describing reality, and this is what we are doing here in the GOE with the modern energy chart. Is we're describing reality, and we're offering techniques that can be proven to work.
yeah,
So there is nothing to be afraid of. It's all good. It's all good. And I'm looking forward to finding out more how this is, this thing is going to progress, how we can, whatever we can do to help to make it so that some
thank you.
perhaps young, impressionable doctors will come and see a workshop with you.
Yeah,
That might be great to start thinking about that, how you would talk to them,
yeah,
what you would say to them. Be
yeah.
awesome.
Probably not too different from what we've just done here. Yeah,
Yeah, just being honest, having a proper exchange of ideas and formulating plans for the future.
yeah.
Okay, so thank you so much for your time, dear
Thanks,
Eric.
Sylvia.
Thank you so
Yeah,
much for your time and lots of love to you. And I look forward to finding out what happens next.
thanks so much, Sylvia. Take care. God bless.
Thank you very much.